Okay, so what's your name?
My name is Amber Massey, and I'm a nurse at Vanderbilt.
Okay, and how has COVID affected your job?
I am a research nurse. I work in HIV vaccine research, and since COVID 19, the pandemic started, we have pivoted our research to coronavirus vaccine research.
Okay, once the coronavirus happened, how did it change, like, the timeline of your job? Like, were you working from home? Were you still directly with COVID patients, or?
So, when the pandemic first started and everything started locking down, I was at home for a few weeks, and we didn't really know when we would go back, or if we would go back, or if we would have a job to go back to, because I was not a bedside nurse, did research. So, and we couldn't bring healthy volunteers into the clinic to give them trial vaccines because of the pandemic. So, everything was kind of put on hold, and we were just kind of waiting to hear. And then they decided that since HIV experts were experts in virus prevention and vaccine development, that they would kind of turn the whole network into what they now call the COVID Vaccine Prevention Network.
Okay, so were you ever working with COVID patients to get ready for the trials, or?
So, I have worked with several recovered patients, people who are 2 weeks or more past their initial diagnosis of coronavirus. I have also gone to some homes where people who are known positive for COVID, and they have recovered, but it's not known whether or not their family is positive yet. So we've had to don the whole PPE and use precautions as if everybody in the house is infected, even though it's unclear whether they are at that time. So.
Okay, and why did you end up having to go into people's houses? Were they just not wanting to bring them into your offices, or?
Right, because the CDC issued guidelines that said that if you were diagnosed or if you had come in contact with somebody who had COVID, you needed to quarantine for 14 days. And we still wanted specimens from those people because they have antibodies and they have certain markers that physicians look for to help develop a vaccine. We would still go to their homes, or we would go to them instead of them coming to the clinic. So we would go to their homes, don the PPE, draw their blood, take a nose specimen or stool sample or whatever the protocol called for, and then bring those back to the lab. So that I helped with that.
Okay, so what about right now? What are you doing at your job? Are you working directly with COVID patients, or are you getting ready for your vaccine trial, or?
So both. The We're still working with COVID patients who are recovered. They're coming in for like their second and third visits. We're following them for up to a year, and then our vaccine trial is set to start in 2 weeks. And we're going to be recruiting high risk individuals, so people over the age of 65 who are at high risk for complications of coronavirus, people under 65 who have pre existing conditions like heart failure or heart disease, and then people in high risk jobs like healthcare workers or first responders. So, anyways, we're going to give them either placebo or a real vaccine and try to determine whether or not the vaccine is effective. And that starts at the end of July. And if any of those people, which we assume they will, contract COVID 19, we'll bring them in, do collect a PCR test from them, and follow them through their course of COVID 19. So we'll definitely be seeing some active COVID patients.
Okay, how has this affected you as a nurse as far as your family, like, bringing it home and stuff?
So it's definitely changed my just idea of what's clean. So we usually strip down in the garage when we get home and before we come in, and then we go shower. Just because, especially on days where I've been in contact with people who might be positive. And just we really sanitize. And if I was ever exposed, like a known exposure with no PPE, I would quarantine. We kind of have a plan in place for that, and Luckily, that hasn't happened. I've had access to the PPE that I need, and we've really been careful. The whole hospital is now masking and things like that. So, but it's definitely changed the way we act at home and how often we wash our hands and things like that.
Okay, and how has the hospital changed that you've seen since COVID?
So at Vanderbilt, they've closed a lot of the entrances to the hospital, so there's really only one way in. Everybody has to be screened at the door to see if they have symptoms or if and they check them for fever. And then even before Nashville had universal masking, Vanderbilt had universal masking. We had to have a mask at work. I think really since we've been back at work. So that's the biggest changes.
Okay, thanks. I think that's all I have.
Okay, thank you.
Thanks.